New York City's hospitals with two bleak words. It is apocalyptic. At Elmhurst Hospital in Queens, 13 people died from COVID-19 in a single day. Elmhurst ER Dr. Colleen Smith gave a stark account of what she has witnessed to the New York Times. Watch this.
All the patients in this room, all the feet that you see, they all have COVID.
The frustrating thing about all of this is it really just feels like it's too little too late. Like we knew it was coming. Today is kind of getting worse and worse. We had to get a refrigerated truck to store the bodies of patients who are dying. We are right now scrambling to try to get a few additional ventilators or even CPAP machines. If we could get CPAP machines, we could free up ventilators for patients who need them.
We now have these 5 vents. We probably, unless people die, I suspect we'll be back to needing to beg for ventilators again in another day or 2. There's a mythical 100 vents out there, which we haven't seen. Leaders in various offices, from the president to the head of health and hospitals, saying things like, we're going to be fine, everything's fine. And from our perspective, everything is not fine. I don't have the support that I need, and even just the materials that I need physically to take care of my patients. And it's America, and we're supposed to be a first world country.
If anybody has any questions as to what is actually going on in this country right now with regards to the coronavirus and how hospitals are maxed out, they need to watch that piece. So a doctor at Brooklyn Medical Center said they are in disaster mode, and that she and her team, they just pray and they try not to get paralyzed by fear. Imagine that feeling. So with supplies of protective equipment running low, nurses at Manhattan's Mount Sinai West have resorted to shielding themselves against the virus with trash bags. That same hospital lost one of their own, nurse Caius Jordan Kelly, only in his 40s. He died after treating patients infected with COVID-19. Joining me now, NBC News correspondent Ron Allen, who is outside of Elmhurst Hospital in Queens, and the New York Times reporter covering the situation in Elmhurst, Michael Rothfeld. Michael, I'm going to start with you on this one. You are reporting about the situation inside of Elmhurst, and you go on to write this. Calls over a loudspeaker of Team 700, the code for when a patient is on the verge of death, comes several times a shift. Some have died inside emergency rooms while waiting for a bed. You also describe a moment in which doctors are helping one individual patient while another individual patient is found dead in their room. What are these people telling you about what they are seeing inside of the hospital?
They're describing being completely overwhelmed by what they're experiencing. So many patients are coming in at the same time, and they just can't handle the workload. People are too sick, and essentially, it's just beyond what the system is built to handle.
What is behind, from what you're finding and you're reporting, Michael, what is behind the number of deaths here? Patients waiting to go to the hospital and coming in sicker? What is actually happening here? Because you described the scenario in the piece that you laid out in the New York Times where an individual tried to get testing on Monday, was refused testing, went home, got even sicker, came back Tuesday, was waiting hours and hours and still no test, still not necessarily knowing what's going on with them.
Well, Queens in particular does not have a lot of hospitals, and it's one of the hardest hit boroughs. They had 32% of the confirmed coronavirus cases. So Elmhurst serves a low income population. So many people are coming to the hospital. So the emergency room is just filled up and the waiting room is filled. And so they set up these tents outside, and it kind of relieves the pressure for people to go to these tents to try to get tested. But it's just so many people, the whole idea of flattening the curve is so we can spread it out. Right now, there's so many sick people. Some of them who went home and waited it out have become more sick, and so they're now coming in and they're getting even sicker within a matter of days and hours, and it's all the doctors and nurses can do to try to handle it with the limited, just like at other hospitals all across the city, as you described. It's just, it's overwhelming, the system that we have right now, the number of people who are sick.
Well, and you bring up in your piece piece, Michael, here that it's not just public hospitals. A lot of people can look at this and say, oh, well, Elmhurst Hospital is a public hospital in Queens. Maybe they don't necessarily have the resources that other private hospitals have throughout New York City, but you're not just seeing this at public hospitals here.
No, it's not the fault of the hospital. It's the pandemic that we have. It's just the sheer volume of people that are sick is just beyond. I mean, one doctor said this is beyond our worst nightmare. It's nothing that they anticipated or that any of us really anticipated. It's the sheer numbers, and so they're doing all they can. They're doing all they can with the number of ventilators that they have, and they're just trying to keep, as Dr. Smith.
In other words, it's incomprehensible. It's going off into an area that even the most advanced imagination ordinarily cannot even begin to fathom or conceive, because we're drifting off into areas that we have never ever experienced before. It's incomprehensible for the mind to actually obtain it. That is what is going to hit the United States of America unless we can starve this virus out. Because it's not just after the old, it's not just after the young, it's not just after the poor, it's not just after the rich, it's not just after those who hold predominant positions here upon to the planet. It's not just after one particular culture or another. It does not discriminate. It's based around the Holy Spirit, and rather not that God is with you. It's based around how clean that you can be. It's based around whether or not God is on your side, and it's based around whether or not you can follow instructions towards staying out of the limelight pertaining to the public and starving this virus out. That's what it's up to.
Said in the video, like nobody's coming off a ventilator unless somebody dies, then they get another ventilator, or if another hospital will lend them some ventilators, they'll do that. But it's not about public hospital versus private hospital. All hospitals right now are under extreme strain.
And as you mentioned, they are getting shipments of ventilators in, but it's not enough. Maybe they're getting 3, 4, 5 extra ventilators. That's just not enough to handle the amount of people that are getting to the hospital. So with that, Ron, I want to turn with you. Thank you for being patient for us. I know that you're outside of Elmhurst Hospital now. What have you been seeing so far today there?
Well, we've been seeing a constant flow and arrival of emergency vehicles. There's not one at the moment, but here at the ER, we've seen ambulances come and go just constantly for the time that we've been out here since early this morning. We also saw a long line for testing that wrapped around this area that they've got set up for it. There's no one there now. They've put up a sign saying that there are no more tests happening today. Wow. We don't quite know why, whether it's that they've run out of tests or they've run out of capacity. We've not gotten a lot of answers from the hospital. That's what we've been seeing all day. We've been hearing that people, this is the only place they have to go. And I think there is something of an economic variable in all this. This is a diverse, immigrant, low-income area of the city. Queens, as my colleague pointed out, does have the largest number of cases in the 5 boroughs of Manhattan, of New York. New York has half the cases in the country, half the new cases in the country. I mean, it's just a staggering amount of numbers. One thing that the local leaders here are wanting, is for one of these temporary hospitals that we've heard so much talk about. They want it to be built somewhere nearby here. It's one thing to build them over at the convention center. It's another thing to build them at on campuses, college campuses up in the suburbs. They want something to happen here on the ground, very close by. because the plan is to transfer patients out of this hospital, which, by the way, is at 125% of capacity as we understand it.
Wow.
The plan is to transfer non-COVID patients out of here, and this will become a completely 100% COVID-19 treatment hospital center in the days to come. But again, the local leaders want to see some more infrastructure built here, not just across town, to serve this community as well.
And I just want to talk about some new numbers that we're getting in before I let you guys go. We have a senior FDNY official basically telling NBC News that 131 members of the FDNY have now tested positive for COVID-19. It is penetrating every part of this city and going beyond the borders of New York as well. Ron Allen, Michael Rothfeld, thank you both for your reporting. Very much appreciate it. Stay healthy, my friends. So Mississippi's governor is not just refusing to tell people to stay home. He's issuing orders to accomplish the opposite. I have a mayor from Mississippi who has decided to do what his governor would not, and he's joining me next.
The American Red Cross urgently.
Now, how insane is that? When everybody is saying one thing, that's kind of like Donald Trump. And you got one person that's saying just the opposite.
Essential.
How insane is that?
Go to the post office again.
There are 21 statewide stay-at-home orders across the country, but a lot of southern states are notably not on that list. Instead, cities and towns have chosen to act on their own. But in Mississippi, the governor issued an order to override laws made by local officials in response to the crisis. The order classifies most businesses as essential, allowing them to stay open, even as cases of coronavirus in that state are rising. Joining me now, the mayor of Tupelo, Mississippi, Jason Shelton, and the director of Columbia University's National Center for Disaster Preparedness, Dr. Irwin Redletter. Mayor Shelton, thanks for joining us. I'm going to start with you first. On Saturday, you ordered some of the strictest safety measures in your state. You have now had to walk them back after the governor's executive order. Notably, Reeves's executive order supersedes any orders by local mayors, governing body in Mississippi that conflict with the businesses and or he deems exempt as essential businesses. So what do you make of these new regulations here?
Well, in Tupelo, we declared an emergency February 24th. This is something that we've known is coming. It's, global pandemic. We've tried to be proactive here. We have a large medical community in Tupelo. We're listening to our doctors. We're listening to our scientists. We're following the CDC and Mississippi Department of Health guidelines. We've all got to flatten the curve. That's what we've been trying to do. The governor superseded that expressly, directly in his executive order. So what we have to do is, we can't go further than that pursuant to the express language. So what we're trying to do is see what we can do to continue our efforts to keep people from getting sick in Tupelo.
So let's talk about that, what you can do. What are you doing to keep your citizens safe in Tupelo? If you talk to many experts, they say a lot of the country was behind the numbers. When you were seeing cases pop up, you should have started shutting things down then. So is there any way at this point that you can appeal to the governor and say, if we don't get ahead of this now, the cases are going to continue to rise and then it's going to get out of control?
Yeah, well, I had a conversation with the governor on the phone this morning, very cordial, very professional, but I expressed the concerns. They're twofold. One, if we're going to flatten the curve, we have to listen to our doctors. We have to listen to our scientists. And the second is there's very little in the governor's order, but there's not statewide uniform action. So in Mississippi, it's being left to the cities and counties to take action, and every one of them are doing something different. So if Tupelo closes non-essential businesses, it's sending people by car to neighboring cities, which is exacerbating the problem. It's creating more travel, more personal interaction, rather than the social distancing to flatten the curve. So, we need consistent, uniform action from federal and state level. What we've seen is that the goalposts keep moving. You'll have, from the national level to the state level, follow these recommendations, do these things, then you'll see an order come that doesn't say that. So businesses, individuals keep having to follow changing rules. The goalposts keep changing, so we need consistent from the top down leadership. And it's an emergency. We have to treat it like an emergency. If we're going to flatten the curve, if we're going to save lives, we have to take decisive, immediate action that is uniform across our state and across our nation.
And you keep in mind that Corinth, Mississippi is just below the state line, below the Tennessee state line. And about an hour and a half, something like that, beyond Corinth and beyond Memphis, Tennessee, you have the great Elvis Presley, Tupelo, Mississippi, which is a smaller community. It's nothing big, but it's so close to the neighboring state that could actually be bringing in contaminants. I don't blame this mayor one bit, especially with it being that close to Memphis, down by I don't forget the name of it now, where all the casinos are below Memphis. Tunica, Mississippi. With it being that close to that area and so many people still traveling to and from, I really don't blame this mayor for contradicting the governor, because the governor obviously don't care about its citizens. You have to ask yourself a question. The $64,000 question. How come all these other officials are recommending for their citizens to do one thing, but then you got somebody like Donald Trump or somebody like this governor down in Mississippi that's going in the opposite direction? That is counterproductive. That could very well cost this governor not only his election, but he could very well be sued by the ambulance chasers of people that wants to get in behind this and sue his administration for millions and millions and millions of dollars per death, per person. You know, whenever I was down in the lower part of Mississippi working the Katrina damage, and I'm just assuming that their capital is in Jackson, Mississippi, which is give or take about 4 and a half hours from the Gulfport, Mississippi line. I just couldn't believe that the governor and their state Congress and their state Senate, their officials, would set back and allow for the good citizens of southern Mississippi to be raked over the coals the way that the insurance companies was basically stealing and basically robbing people blind. I mean, literally robbing people blind. I know now why all that occurred. Whenever you have this type of corruption to the point that the governor himself sees more interest in commerce than he does human casualties, I see now why this is occurring. And if all places of the hundreds of millions of people or thousands of people, out of all the coronavirus catastrophes, probably Mississippi will be one of them that will come up with some sort of a rejection plan of their market base pertaining to those who have life insurance policies, regardless whether it's Allstate, State Farm, Farm Bureau, Allstate, Farmers. I mean, there's hundreds of insurance companies, privatized, mama, papa, as well as your international insurance companies. Out of all the places, they'll probably come up with some sort of closure, if not before this all is over with as the dust settles. Possibly after that, in case of another pandemic, people are not going to be covered under various insurance policy clauses. And you may be saying to yourself, Juby, nobody's going to put that in their clause. Please listen to me. Whenever I seen people's lives ruined over them having policies that they've had for 30, 40, 50 years and never turning in any type of a claim until Katrina hit. And then all of a sudden, the very same people that thought that they was insured for 100, 150, 200, 250, maybe up to $500,000, come to find out the insurance companies wasn't going to provide no type of insurance for them because it was not a flood insurance claim. Understanding that it was the 180-mile-an-hour winds that racked up a monsoon, a wall of water, basically 40 feet high, that swept into the lower part of the Mississippi, that caused so much devastation in people's personal property. To see people ruined like that, as far as I'm concerned, every one of the insurance carriers that was involved in that needs to go to jail. All their state senators and Congress needs to go to jail. Anybody associated with the Katrina damage that was a part of doing their clientele, their customer base that way, needs to go to jail. They need to be held to the fullest extent of the law. And I'm pretty sure it probably went on in Alabama, and I'm pretty sure it went on down there in Louisiana, and I'm pretty sure to some extent it went on in Florida. Basically, the things that was going in Florida pertaining to going down and being an adjuster is that they would take a house that had been riddled, and let's say the top of the house was, part of it was still intact. Well, they would get in there with a measuring stick, a ruler, and say, well, you still got 4 foot of an easement here on your house that could do something. So they got to prorating people's damages. In other words, they was squandering on what that they should have rightfully paid their clients or their customers. And they not only done that with roofs, but they done that with exterior and interior walls. They went in and just picked, trying to save a dime here, trying to save a dime there, trying to save a nickel here, trying to save a nickel there. And that is fraud. That is nothing more than fraud. Because whenever your claim says one thing and they're doing something totally different, that's being fraudulent in your promises that you promised your customers that you would take care of them in case XYZ happens. So I'm pretty sure Mississippi will probably be one of the first states that will put into some sort of clause after the dust settles that we will no longer provide life insurance for anybody in case of a major pandemic. Because I'm sure under the same statutory pertaining to the guidelines of a catastrophe, it will literally ruin mama and papa businesses that will not want to pay out on certain insurance claims, regardless whether it was an elderly person or a young child. And you may be saying, Dennis, there's no way that the insurance companies are that raw and that dirty. I promise you they are. I promise you they are. Because I've worked with them all my life, and I know how that they'll prorate a part. Let's say you get a hub, a spindle damaged in an accident, and it was the other person's fault, right? Well, you think you're going to get a new hub and a new axle. No. If your automobile has, let's say, 90,000 miles on it, they're not going to put or pay for a brand new axle or a brand new hub. Now, they'll find one out of the junkyard that's already got 35, 40, 50, 60,000 miles on it, and they'll request for that hub and that bearing and that particular part to be replaced that way. Thing about it is, you damage a lot of those parts by taking them off of other parts. Let's say you're taking off a bearing that's got a race and a spindle attached to it. A lot of times you'll damage that part that's got all those little bearings on it. You'll damage it if you're not very, very careful towards taking it out and inserting it into another hub. Well, they don't keep that into account. Just like the insurance companies that got to the point that they was wanting you to put on used quarter panels, used roof skins. It's one thing to put on a used bolt-on part, but to take a part that needs to be welded and cut it loose from another automobile and stick it onto another automobile, you actually do more damage to the part by trying to disassemble it from the original automobile than you do if you'd have just fixed the original damage on the original part. That's how deceiving that they are. And of course, who paid the brunt of the blow on that in most cases? It was the technician. It was the body man or the mechanic that had to go through extra pains toward being extra careful that I can't damage this bearing. If I damage this bearing or if I damage this race on this bearing, the next thing you know, this bearing's going to go bad. And then I'm going to get accused that I didn't assemble it correctly. The same way with the technician that had to cut off the part, because they'll bring the part to you in a chunk, and the technician basically has to be very, very sensitive, very, very careful. He's got to slow his production rate way, way down to be able to cut that part loose. And like I said, 9 times out of 10, you'll damage the part almost to the extent that you'd have been better off fixing the original one. And this is what the insurance companies has put on the backs, the beast of burden, up onto the body shops. Not just here in America, but throughout, not just here in the state of Tennessee, but throughout America. Now, there are some states that red flag them and won't allow for welded parts to be cut off and put on the other parts. There are certain insurance companies that have guidelines that they will not do that. They automatically will say, well, if you cannot find a LKQ part, which is a used part pertaining to a used bearing, after you've done a national research, if you can't find the used part, then and only then is whenever we will pay for a brand new spindle, a brand new bearing, a brand new this, and a brand new that. But it has become so complex with working with these insurance companies towards how that they're squandering and throwing the monkey off on various contractors, regardless whether you're a construction contractor or you're a mechanic or you're a body man, that it has become absolutely insane in the industries. Absolutely insane. And of course, it's all based around the body shop owner or the mechanic owner or the owner of the construction outfit towards how many loops, how many hula hoops, how many cartwheels that they're willing to not only do themselves, but how much burden that they're willing to throw off onto their labor force. Unbelievable what people would do for the almighty dollar bill here in America. Unbelievable. The burden that they're willing to throw off on other people to try to pad their own pockets, especially in the center of a catastrophe, a disaster.
Dr. Redletter, talking about some of these southern states, Mississippi pointedly as well, they have a lot of cases already. 377 cases in Mississippi, 5 deaths. I could go on. Louisiana, 1,795 cases, 65 deaths. Florida, 1,977 cases, already behind really when they should already have shut things down in those states as they have here in New York City. And you see in New York how the cases have progressed so rapidly just from last week, even day to day. So what do you make here, Dr. Redletter, of the governor's orders?
So, Yasmin, so there's a couple of points to make here. First of all, I just want to congratulate the mayor of Tupelo and the other mayors and city officials around the state of Mississippi for trying to do the right thing here. And so that's number one. And I really congratulate you and thank you for what you've been doing. Secondly, we are all suffering. The entire country is suffering from a lack of consistent message that has actually started at the top. But we've seen this for weeks and weeks, where the president would say, everything's under control, and 5 seconds later, the head of the CDC or one of the other public health organizations saying, no, it's not quite right. And I'll tell you this: there's exactly one thing that we can do right now, because we don't have a medicine that specifically can treat this virus, and secondly, we certainly don't have a vaccine. We're not going to have it for a long time. So the only action we have to do to save lives and to stop the spread of this disease and flatten the curve, as we're talking about, which means really just reducing the spread. The only tool in our toolbox are these very strict ideas that come from public health professionals based on science and modeling that say everybody needs to stay inside. We actually need a national, non-overridable ruling from the federal government that says the entire country, if that's even possible, should be on shutdown, and the governors, each one of them, need to implement that. The fact that the governor of Mississippi is in a confrontation now with science and public health practices, and in a confrontation that's going to cost lives, we can almost guarantee that people in Mississippi will die because of whatever's prompting or promoting this idea that the governor's been spreading, that somehow he should override appropriate public health practices. It's staggering. I don't think we've ever seen anything like this before. And I think that hoping the mayors of Mississippi will continue to push this. Do they have to go to the courts? What else and where else can they appeal this? But lives are at stake. I can't say that strongly enough. And I think we need to find a way to get the governor to change his mind, either voluntarily or in some way being forced to by the courts or whatever we have to do.
And actually, New York's Governor Cuomo said, in spite of the numbers rising here in New York City, the guidelines, the social distancing, the shelter in place is actually working, because we're not hitting those worst case scenario numbers in the hospital, despite the fact that the hospitals are being overrun. We're not at the point in which they thought it would be worst case scenario if there were no guidelines in place. So important points to be made there. Mayor Jason Shelton and Dr. Erwin Redletter, thank you to you both. Coming up, Mass General hoped this stockpile of supplies would see them through the worst of the pandemic. Why they're already nearing their worst case scenario. We're also going to head to Virginia, where the hospital ship Comfort is getting ready for deployment to hard-hit New York. We'll be right back.
Hello, I'm Mike Lindell. Stupid. It's insanity. It's gross negligence. It's irresponsibility.
To Los Angeles, and the USNS Comfort is preparing to leave for New York City, the epicenter of the nation's coronavirus crisis. Join me now from Norfolk, Virginia, NBC News national security and Pentagon correspondent.
I wouldn't want him to be my governor.
And Courtney QB. Courtney, good afternoon to you. Thanks for joining us on this. Let's talk first about the USNS expected to arrive in New York City. What is the plan here with regards to the dire help that hospital needs now?
So we know now, just in the last couple of hours, Yasmin, that this ship behind me, the USNS Comfort, is going to deploy out of Norfolk in about the next day or two, and it will be in New York City and seeing patients early next week. We heard that just today. This ship is really a floating hospital, as you know, Yaz. There's about 1,000 beds on it and about 1,200 medical personnel. Most of them are uniformed Navy. When it gets into New York City, it's going to be taking some of the excess patients, the surplus patients that the New York hospitals are so overwhelmed by right now. That we've been hearing all day today about how the New York medical system is really overloaded. Well, now this hospital will be able to take over the trauma patients, the day-to-day cases that the hospitals just cannot handle. What will happen is the hospitals will take the people in and then they'll transfer them to the ship. There may be they will not be seeing any kind of coronavirus patients. One thing we've been asking here is how will they mitigate the potential for spread of coronavirus on the ship? It's very tight quarters. There's not a lot of opportunity for isolation. The hospitals in New York will test the patients, make sure that they're clear before they come on board the ship to ensure that those medical professionals aren't exposed to any of the virus, Yasmin.
All right, Courtney QB, stay healthy, my friend. Thank you. So as we've been talking about, hospitals have tried to stay ahead of the predicted surge of patients. 3 weeks ago, NBC News went to Massachusetts General Hospital to see their stockpile. The hospital hoped that this warehouse that you're seeing here, full of gloves, gowns, and masks, would see them through the worst of the pandemic. You would expect it would, right? But Mass General has already tapped into that supply. According to their chief of emergency preparedness, it is the worst case scenario. They're already there. Joining me now from Boston, the vice chair for emergency preparedness at Mass General, Dr. Paul Bittinger. Dr. Bittinger, thanks so much for joining us on this. Appreciate it. Talk us through this, because our understanding was that you had this massive stockpile. You were ready for something like this, but you are now at a moment that you're tapping into some of these supplies that you thought could feasibly get you through this difficult time.
Oh, Lord.
Sure. Well, certainly a lot of the reason that we have this stockpile is because we think we might need to use it. We have been working on this for more than a decade. It has exactly what you said, the gowns, gloves, respirators, masks that we need. The challenge is that we still think we're several weeks away from the potential peak of this outbreak, and therefore tapping into it a little bit early is of a challenge to us. So this is one of the weapons that we have. We have been working so hard with all of our supply chain leaders to make sure we've identified any other possible source for masks, for respirators, for gloves. But ultimately, the top priority is keeping our workforce safe. And so if we have to dip in now to make sure that we have the resources to keep our workforce safe, that's what we're going to have to do.
How long, Doctor, do you think that stockpile can last you at this point?
So the way we've modeled it is that if we had a complete shutoff of all of our supply chains, we think it's about 2 weeks. I'm really glad to say that that's not where we are. We have a lot of effort going on in our supply chain, and we are working with suppliers so that we think we will get through. I will say we think that we can sustain our stockpile, but we are using everything extremely closely. We've actually enacted extended use, reuse protocols for our personal protective equipment supplies, just like so many hospitals, so many systems around the country. That's what's necessary to get us through, in addition to using this stockpile.
Is it out of the ordinary to have a stockpile like you guys have at Mass General? Do other hospitals have the same type of storage facilities?
I know that some do, certainly the bigger systems, bigger hospitals, but I do acknowledge that especially for smaller facilities, this is really, really hard to do. It's one of the principles of modern business practice is that a big warehouse, a big inventory is costly and loses you money. So it's not common. Not everybody has it. It's what we've thought was prudent all along. And of course, unfortunately, in these terrible times, we're glad that we have it.
So I want to get to this last question before I let you go. As we have been reporting, a lot of healthcare workers are now contracting this virus. You have at least 41 staffers from your hospital that have contracted COVID-19. How has that changed the plan, and also how are they doing?
So we're really happy to report that the majority of our workers who we know have contracted the illness are doing well. We're doing very careful case analysis to figure out where they got it. And so far, with the vast majority of workers who we believe have contracted the virus, they've done so in the community as opposed to at work. And so, again, it's extremely important to provide a safe work environment for our staff. But we look into every one of the cases to try and see if there's an issue there. We, in fact, have changed our personal protective equipment policies. One of the things that's been so surprising about this outbreak is how much asymptomatic transmission there is.
Right.
People who feel completely well have the virus. So we're using our masks. We'll protect our workforce, and we will get through this.
Dr. Paul Bittinger, you are a voice of calm amidst all of this, and I appreciate that. Thank you. I think our viewers appreciate that as well. Coming up next, Sky News takes us inside the epicenter of Italy's outbreak. We'll be right back.
once more, a stitch in time saves nine, and they was smart towards getting extra supplies. I don't know if they got a bargain on them or what, but whoever it was that done that has absolutely no regrets now, because now they are calling up onto those supplies that they direly need, that may get them over the curve until other factories and other suppliers, other vendors can come up with some other reasonable resources towards being able to order masks and gowns and et cetera, et cetera, et cetera. I think the main deal right now, and I've always said this, is the testing tubes or the testing utensils that they use to be able to test somebody to make a determination of whether or not they even have the virus or not. That's the main thing that I can see. You know, I want to say this to my viewers. I find it to be a privilege to be able to sit here at 291 Thompson Road and document, record, streamline, to put on my YouTube channels the events that's going on right now. And I know that people looked at what went on in the White House pertaining to the impeachment trials, of it being monumental, historic. But I guarantee you, this will top the impeachment trials. This will top 9/11. This will top just about any other worldwide occurrence other than possibly a world war. Because these will be things that will be talked about, written, recorded, for the historians one day to sit down and look at and say, my God, this is where they messed up. They didn't do this, 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 and this right. Because they'll be able to look at all this from a hindsight point of view, the same way that we can look at the Civil War today and say, well, that's where they went wrong. They didn't do this, 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 and this. The South didn't have enough bullets. The South didn't have enough monetary funds to be able to back their war. And that's the reason why the Confederacy had to surrender to the Union. You know, we can see those things today because we have become part of the historians looking at the historical event that actually occurred during the Civil War. But now, they wasn't thinking of that then. People wasn't thinking about that then. Just like the event that happened during 1918 of the Spanish flu. People didn't have good communications back then. People wasn't dialoguing and putting this down on paper and recording this like they are today. Today they are. You know why? Because now we have certain tools. We have certain equipment. We have certain devices that we can do this on. So if there's ever become a day that we need to be more prevalent in documenting the facts towards what we done wrong, what we done right, what this particular area done and what that particular area done, if there's ever been a time that we needed to put it on paper or put it in the cloud or put it on data form, that way 100 years from now, the same generation that's growing up then will be able to understand what we went through today that could actually help them in the future. It could help them towards what we didn't do that they may be able to do in case of another big emergency worldwide event. And these worldwide events can come in the form of either a pandemic, they can come in the form of a world war, they can come in the form of a meteor falling out of the sky and basically darkening the stars and the moons to the point that crops won't grow accurately. These emergency type events can happen at any time to any culture to any generation. So the things that we record today may very well help to save lives tomorrow or the day after tomorrow, pertaining to looking at it from a spectator point of view, by looking these things up and saying, wow, this is what this individual had to say. Wow, this is what these people had to say. Wow, this is what this group of people had done. This is what these people done. You know, all these things are hopefully in the form of being proactive. That way, not if, but when there is another worldwide catastrophe. And that's what this is turning into. It is turning into a global catastrophe, a global disaster, a planet disaster. That maybe those that get a hold of our material, look at it, dissect it, analyze it, read about it, listen to it, can make sense of it to the point that they won't be caught blindsided as badly as, let's say, the people in the Civil War, or the people in the 1918 pandemic, or the 2020 pandemic that is now circling all over the planet. We are a prelude to the generations that comes after us, pertaining to our children and our children's children, towards hopefully helping them to the point that they do not have to go through the anguish, they do not have to go through the remorse, and they do not have to go through the pain and agony such as we did. That's what we hope for as a society. And that's all that any of us can hope for, is that the mistakes that we made today will help other generations in not making those same mistakes. Because I truly believe that there will be a remnant of people.
Now approach.
There will be a remnant of people that will rise out of this. And there will be a remnant of people towards the meek, the true godly, overcoming and becoming stronger towards the bride of Christ that will properly prepare itself for the second coming of the Lord Jesus Christ. In other words, this is a time of profiling or prepping for the next generation that comes beyond us.
In 21,000 globally. Countries around the world are putting restrictions in place to stop its spread. Russia saw a surge in coronavirus cases this week. Today, officials announcing they're grounding all international flights starting tomorrow. Thailand has shut down its airports, stranding travelers. And they're banning all foreigners through the end of April. And then a massive lockdown is now in place in South Africa. Doctors and nurses there are conducting roadside health checks as well. The situation in Italy also remaining very serious, but there are early signs that the virus may be slowing. The daily number of deaths fell for the first time this week, but in the hard-hit town of Bergamo, the sound of sirens remains ever present. Here's Sky News Chief Correspondent Stuart Ramsey.
It never stops. They're telling people to stay indoors. This is what a total lockdown looks like in the center of the coronavirus epidemic in Italy. This is Bergamo, the dead center.
Coming near a neighborhood near you, unless we do what they didn't do, which is to heed the warnings and go in and become isolated. Isolate ourselves and basically starve the demon out. Starve the monster out. Because the way that the monster grows and intensifies is from one human being to another human being. Okay? And if the monster don't have human beings to evolve off of, eventually, instead of it evolving towards it growing stronger and bigger, it will peter itself out. It will die out. If we cannot find some sort of an antidote that will build up people's immune system to the point that it won't no longer be as lethal as what it is. But we ain't no telling what before we ever hit that plateau. And we know it. So the next best thing in defense is to do like the experts is telling us, self-quarantine. Go inside. Go inside.
It's quite scary. You don't really get used to it.
It's eerie. It's that odd or unusual. Your mind cannot wrap yourself around something this odd, this unusual. It's incomprehensible.
It is apocalyptic, and of course here they're calling it the apocalypse.
I'm sure.
It doesn't feel that life here will ever be the same again.
And it won't.
In the total lockdown, volunteers take food and supplies to the most vulnerable, the old and the already sick. They also take medicine to those who would simply die if they were infected. Valentino Trivia lost his uncle to the virus this week. Like so many, he wants to help. Like so many, he's broken inside.
Perché
It's sad.
stiamo sentendo
It is sad.
stiamo sentendo molta gente che è in difficoltà. Quindi tanto stare a casa continui solo a pensarci e basta. Un po' di aiuto.
The mayor, Giorgio Gori, who brought his daughters home from the UK so they could live under the lockdown in Italy because it's safer, is working 20 hours a day. He admits he's obsessed with COVID-19 data, contacting the mayors of other towns and building a picture of the actual death rate here.
There isn't any official study on this.
He's convinced the official numbers are an underestimate because too many deaths aren't being included. The number of dead may actually be higher.
Yeah.
Why is that?
In this moment, only people with heart symptoms are tested in the hospital. If you are with a high temperature in your home with cough, you are not detected. The doctor will say you stay at home, take this medicine, and if you breathe quite well, you don't need to be recovered brought to the hospital. So you are not in the statistics.
Yeah.
Okay? If you die in this condition, you are out of the radar. You are not considered as died for coronavirus.
Recent figures have indicated that death and infection rates are slowing, but in reality, you'd never know. The sirens never stop.
Another ambulance passes. It's an absolute constant in the red zone. People are still being picked up, all the time. So you will pass ambulances. Literally, if you stand still, an ambulance will pass you every 5 minutes. Lights on, and the driver's in full hazmat suits. It's quite astounding, actually.
There is clearly a very long way to go. Overnight, the military cleared the bodies from the hospital morgue in the town because it was full. This is the next day. The morgue is already filling up. It seems absolutely endless. Stuart Ramsey, Sky News, Bergamo, Italy.
A couple weeks ago, if I had seen that video, I would have thought to myself, that's never going to happen here. Now I am not so sure. Thank you to Stuart Ramsey from Sky News for that. That does it for me today. Ali Velshi picks up our coverage after a quick break.
My advice to my viewers is that don't never underestimate the value of a human being's life, number one. Number two, don't never think that you're invincible, regardless of how old you are, how young you are, how smart you think you are, how rich you think you are. Never underestimate the power of Mother Nature, regardless whether it comes in one form or another. And this is just another lethal, deadly form of the Bible fulfilling itself towards the signs of the great sorrows because of all the wickedness and all the sin and all the corruption throughout societies. May God have mercy on all of us, and good luck to all of us as we go through what we're going through. Here at the Windmill Ministries at 291 Thompson Road, we cannot tell you how essential that it is that if you've never had a true relationship with Christ, now is that time to make sure that you've got it right. Please make sure, because it's only going to be by the will of God and His precious Holy Spirit that's going to prevent catastrophe of falling into your lap. No matter if you got a mask, no matter if you got this or got that, it's still going to be truly by the fate of God that's going to prevent you or I or anybody else from falling victim of what is happening here worldwide. If I'm not mistaken, the last time I looked, their fatality rate, their death rate over in Italy alone was somewhere, give or take, around 6,000 or 6,500. It is so sad. I'm pretty sure that the burials and the crematories over there towards doing what they're doing to the dead is probably running day and night. The crematories that's cremating people are probably running day and night, kind of the same way that it was doing over there in China. We are living in the last days, my friend. Regardless whether we like it or not, we are in the last days. We are in the year of the Jubilee. Shalom.